Welcome to our series called Mama Needs a Minute, where we discuss all things motherhood and well-being, because sometimes you just need a minute. This is brought to you by LunaYou, a maternal health program geared to empower women through pregnancy and after birth with our awesome partner, Neighborhood Health. During our session, feel free to leave questions, comments, or emojis in the comments. We can't wait to engage with you. So today I'm honored to have a special guest, Donessa, who is a LunaYou student intern who has focused her studies on maternal health. So hi, Donessa, tell us a little bit more about yourself.
Hi, thank you all so much for having me here today. I'm really excited to spend some time with you all. As Penelope said, my name's Donessa. I'm a current senior about to graduate at Brown University, and my major, I guess, that I've been focusing on over the course of my last few years is health and human biology. But within that, one of the areas I've been focusing on a lot is maternal health in my classes. So after studying in the maternal child health class last semester about racial disparities amongst maternal health outcomes in the state of Rhode Island, I really wanted to get involved with some local community-based organizations and see what type of program-based interventions they were doing to address some of these outcomes and narrow disparities. And I also wanted to see if I would be able to become involved in any ways and use the knowledge that I'd gained from my studies to attempt to leave LunaYou with something meaningful. So this semester, I was honored to have the opportunity to serve as a student intern and really spend a lot of time with LunaYou, such as attending the weekly meetings, but also working to use the information I gained in my studies at the organization. So one of the things I worked in particular throughout this semester was studying doulas and their impact on maternal health outcomes. And within LunaYou, I was able to design some infographics that can be utilized by birthing individuals and their families who want to gain more information on resources surrounding doulas and also just opportunities that they have available to them and their families to help improve some of those outcomes that LunaYou is so focused on.
My gosh, you're amazing. I mean, you've done so much already, and I'm so impressed with all of you brought to LunaYou and all the information. So, what are some really, key points for working with a doula during your pregnancy?
I think, first of all, it's really important to understand how a doula differs from other providers that you have access to. So, a doula is essentially there to be a trained support person who can help you with everything from emotional, physical, or mental needs throughout your pregnancy and also your postpartum period as well. But it's also important to know some of the key benefits of having a doula throughout your pregnancy. And one of the main benefits is improved outcomes for both mother and baby throughout the entire experience. So you see improved attendance to prenatal visits, and you see lowered risk of C-sections at birth. You also see lower risk of postpartum depression developing over the postpartum period. So what's amazing about doulas is that they can actually help in such a wide variety of ways. And they're also able to continue being a part of your journey. It's not necessarily something that exists only in the prenatal period, or if you decide to have children again in the future, you can continue to have a doula involved with your family. And notably, they serve the birthing individual, but they also serve the entire family. So for example, if you have small children and you're trying to adjust to the new flow of things within your family and household, you can also have a postpartum doula around to address that with you. If there's a potential partner, other family members who are around and help you all with that transition. So what's great is doulas are they're beneficial for maternal outcomes, child outcomes, and they can also help with families in general, just adjusting to the new experience.
Yeah, that's amazing. And honestly, I had no idea all of these wonderful things existed with working with a doula. So that's great that you're just bringing awareness to the community and just educating everyone, especially because there's some big things going on in Rhode Island right now, right? With doulas. Do you want to tell us a little bit more about that?
Yeah, so one of the reasons that I actually focused on the potential impact of doulas on maternal health outcomes in my class last semester is because just this past summer in 2021, Rhode Island passed the Rhode Island Doula Bill, which would allow for Medicaid reimbursement as well as private insurance reimbursement for doulas. And this was a really big deal because it really helps to increase access to doulas, especially to low-income families or to individuals who previously just would not have been able to access those services. And now this year in July 2022, that bill is finally going to go into effect. And we're hopefully going to see an increase in the use of doula services across the state, and also hopefully see a corresponding decrease in negative maternal health outcomes. But this rollout, though it's going really well on the legislative front, it's also really important to go well on the education front in terms of educating individuals who could access these services, and also letting people know how exactly it's going to work, because like any other legislative piece of policy, there's obviously loopholes and weird aspects, and you want to make sure that a family does not find themselves in a situation where they're confused or overwhelmed, because ultimately doula care is supposed to be lowering stress, not adding stress to already stressful period in the family's life. So yeah, one of the things I really wanted to focus on during my time at LunaYou was making sure that families knew and understood the rollout of this policy as much as possible, but also were just aware of it even existing in the first place. Because I think it's one of those things that could have kind of flown under the radar for some folks. And so a lot of people, they don't even know it's an option now.
Yeah, I mean, all of that sounds amazing, and you're totally right. I'm sure it's been missed. So just bringing awareness has, I mean, you've been doing such great work, and I hope that, you're able to spread all of this great information with a lot of moms to be and postpartum moms, because I think a lot of women focus more on the birth and prepping for the birth and don't realize that they can get care postpartum as well. So that's amazing. And so I know you created a few infographics for us. Do you want to tell a little bit more about what you created?
Yes, so I was really excited for the opportunity to actually create these infographics, because I feel like a lot of the times in my studies, we'll study topics like this, and then we'll write down ideas of proposed interventions, but you never actually get to do them or work with people in the community and find out what infographics they actually would want to see. So one thing that was really exciting for me was to really spend time talking to Courtney and like the rest of the team and finding out some of the common questions that they get from families, and then being able to take that information back and produce it into like one solidified, hopefully easy to understand document. And I think one of the most interesting takeaways for me was that one of the big questions that Courtney and Caitlin kept telling me they get a lot of times was, what's the difference between a doula, a midwife, and an OBGYN? And it honestly wasn't even a question I'd really thought about, because I'd been so zeroed in on doulas and like coming in and thinking I need to provide that type of information. But I realized, like, first we need to even separate what are all of these things, and understanding the different ways that all three of these providers can help along a family's like journey to welcoming a baby. And then we can get into like what's a doula and what's their benefits. And I think that was a really, really amazing moment for me, because I was able to like meet the community with where they were at and what they wanted to focus on, not just like what I thought might be the main question. And I also realized there were more questions that existed. And what was really exciting was to be able to kind of see how by the time I was done creating even more infographics, we'd have like a really almost like holistic document, or like an explanation, almost kind of like pamphlet or book sort of situation that could hopefully walk a family through some of these really difficult questions that they have to navigate and that like continuously keep coming up.
Yeah, that's amazing. And having a guide like that can make things so much easier. And like you said, there's so many questions that come up with all of these things on top of regular pregnancy questions. So thank you so much for creating those. So with that big question being kind of like the topic of what's the difference between a doula, a midwife, and I guess a primary physician or OBGYN, do you want to share with us what the differences are?
Yes. So within those questions, I also was like starting to see a trend of some specific questions. So people wanting to know, what does this one specifically do that's different? what type of reimbursement do they take? Like, is this something that just takes insurance? Is this something that I would have to pay out of pocket for? And then where are they? Like, does this happen in a hospital? They come to my house? So I guess I can try and give an overview, but also answer those 3 specific questions. So an OBGYN is someone who went either the MD or DO route, but ultimately went to medical school, conducted residency, and most typically they're practicing in like a hospital or some type of larger organization. And they do typically take insurance or Medicaid reimbursement. Versus a midwife also went through a formal medical training process, but they went to midwifery in school instead. So they would be a certified nurse midwife, like a CNM. And midwives are sometimes practicing in hospitals, but a lot of times they're in smaller birthing centers or birthing clinics. And they also more frequently do home births as compared to OBGYNs. And the midwifery reimbursement process really differs from state to state. Some states actually have outlawed midwifery, in particular some red states. But in the state of Rhode Island, midwives can be reimbursed at the exact same rate as OBGYNs. So for individuals in the state, it's pretty analogous to the process they'll experience if they choose an OBGYN. And then finally, doulas. Doulas are trained support individuals, but they're not trained healthcare providers. So your doula wouldn't be delivering a baby. Instead, they would be there as a patient advocate throughout the delivery process, explaining information to a patient if there's confusion. They might also be there during prenatal visits, attending visits with a patient. They might be there in the postpartum period and the bringing baby home experience, helping their client to make sure that the house is safe and well set up for the new child, things like that. So they're all key service providers who are involved in the pregnancy journey and postpartum period, but they serve slightly different roles in some cases, sometimes vastly different roles in different locations. But all 3 are ultimately there to serve the goal of helping someone to have a healthy and successful pregnancy.
Oh my gosh. I wish I would have known all of this during my pregnancies, because I definitely would have used those resources. So that's amazing. Thanks for breaking it down for us. And so now we're going to play a fun game. It's called Would You Rather? Just some fun questions. So you can tell me which one you prefer, and we'll go from there. So do you prefer summer or winter?
Ooh, definitely the summer. I'm very happy with the warm weather that's showing up right now.
Although it is a little hot for me, but I totally agree. I love summer too. I love the sun. So would you rather take a vacation to a beach or a lake vacation, lake trip?
Ooh, that's hard, but I like the waves, so I'm gonna have to go with the beach.
I know that's a tough one too, but I'm a beach person as well. Okay, so because we are, focused on motherhood and babies and pregnancy and all that fun stuff, would you rather be thrown up on or change an explosive diaper?
I'm going to say I'd be thrown up on because I can just change the shirt and get it off fast, as opposed to I'm going to have to deal with that diaper smell for a solid 30 seconds to a minute.
Oh, and there is so much more that comes with explosive diapers. I mean, clothes is a mess.
Yeah.
Can get on your hands. I mean,
too much.
Yeah. Okay. I agree with you there too. Thrown up. Alrighty. Well, thank you so much, and congratulations on your graduating and all the amazing work you've done. You've been a pleasure to speak with today, and a pleasure to have with LunaYou. So thanks so much, Donessa, and we'll talk to you soon.
Thanks so much for having me.